If you're watching this, you or somebody you know is probably trying to figure out the complex mixture of benefits, of plans, and costs newly available for Medicare beneficiaries in 2025. And this can be stressful to say the least, especially when trying to sort out the key important things about a Medicare Advantage plan. That's why today we are going to go over the 5 important things to know about the Blue Shield Select PPO Medicare Advantage plan that is available in San Diego in Orange County, that's California, this AEP. Hi, Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is that best Medicare option for them this AEP or really all year round and live here in Southern California, give us a call at the information down below and we can help them to make those tough Medicare choices. Blue Shield is quite likely one of the most well-known insurance companies in the country. They have Medicare Advantage plans, they have Medicare Supplement plans, they have employer coverage plans, they have health exchange plans, and really everything in between. But in Southern California, specifically in San Diego, because of some of the most major doctors' networks have been a little finicky about which plans they accept, or more importantly, which plans they don't accept, these PPO-style plans, uncommon in Medicare Advantage overall, have become more and more popular. But there really are some important things to know to understand before someone enrolls into a PPO plan. So here are my top 5 things to know about the San Diego Blue Shield Select PPO plan for 2025. First, I think the biggest thing to understand about the Blue Shield Select PPO plan, and really any of the PPO Medicare Advantage plans out there, is that yes, they have a much bigger choice of doctors, they have a much bigger choice of hospitals and doctors networks that are available, but they can come at a substantial increased cost. Specifically in this case, there is a 2-tier system of cost for services provided under the Select PPO plan. This means that if someone goes to see a doctor who is in-network, directly contracted with Blue Shield to provide services at a set price, there is a copay or a co-insurance that is going to apply. But if some folks want to use doctors who are not directly contracted, that are out of network, and really this would be the main reason to get this plan, to go to those out of network doctors and still have some coverage, there is a second and potentially much, much higher cost to go with those services. That is why when we go over these benefits, there will be an in-network and an out-of-network benefits cost that you're gonna see, and they are quite substantial. All right, next up, the Blue Shield Select PPO plan of San Diego and Orange County, so that's the counties that's available in 2025, is the fact that there is actually a monthly cost or a monthly premium that someone has to pay to be enrolled in this plan. Now, for those folks who are coming from a place like work insurance, or maybe they're coming from exchange coverage, or some other under 65-year-old coverage, this may seem pretty intuitive. But for folks who are on Medicare or have been on Medicare Advantage for quite some time, they will know this is uncommon. And I mean, it is uncommon. It's not common for most Medicare Advantage plans here in Southern California to have a monthly premium. And in the case of the Blue Shield Select PPO, it's a $41 a month monthly premium. Now, obviously, that is not a king's ransom, but remember, to be enrolled in a Medicare Advantage plan, a Medicare beneficiary must have both Medicare Part A, which normally doesn't have a cost at all if you work the 10 years or the 40 quarters minimum in the United States. But it also requires somebody to have Medicare Part B, which in 2024 has a Medicare Part B monthly premium at $174, and it's probably going to go up to about $185 in 2025. It's just not released yet. But that is the estimation, and they're probably pretty close. So the additional $41 premium for the Blue Shield plan will be added on top of the Medicare Part B premium, and those are costs that have to be paid every single month, whether someone uses the services or not. Now let's talk about one of those benefits that most folks will not use, but it is super, super important to understand just in case one ever does have to use it, which is the maximum out of pocket, or for short, they call it the MOOP, which is kind of funny, right? It sounds like something your PE coach would have called you back in the day. Be like, come on, get moving, you MOOPs. Anyways, the maximum out of pocket is the most amount of money a Medicare beneficiary enrolled in a Blue Shield Select PPO plan in San Diego or in Orange County in 2025 could pay for their medical services, meaning doctor's visits, urgent care, specialist visits, all that kind of put together cannot exceed that maximum out of pocket. That being said, the MOOP for the Blue Shield Select PPO plan is $4,200 for the 2025 plan. Now that, of course, is going to be for in out-of-network services, which is sort of a lot, and we'll take a look at all this when we do future plan comparison videos, but it definitely pales in comparison to the MOOP costs for out-of-network services, which are more than 100% more at $8,950 for the year for out-of-network services. Now, this is the plainest way to see that despite having the option for out-of-network doctors to be utilized under the PPO style plans, it comes at a hefty price and literally more than double. And this is something that is very important to consider when you're weighing out whether or not you want a PPO plan, because there are situations where maybe you have a set of doctors in disparate networks who saved your life, or maybe you're fully healthy. You don't need to see any services at all, but you want to have the ability to go see those doctors if you need them. Ultimately, what it comes down to is one's preference and one's budget and one's health situation. Next up, and sort of in the same vein, let's talk about the deductible on the Blue Shield Select PPO plan, both in and out network. Common for many, if not most, Medicare Advantage plans, especially the HMO version of these plans, there typically is not a deductible required. And this is the same for the in-network services on the Blue Shield Select PPO plan. This means that for in-network doctors, specialists, urgent care, physical therapists, enrollees can go to see them and pay just the copay or the coinsurance that goes along with that service. But again, making that distinction for out-of-network services, there is going to be a deductible of $750 a year. This means that the Medicare beneficiary, when utilizing services out of network, will be responsible to pay for the first $750 of their own healthcare costs before the cost sharing or the copays, the coinsurance kick in, which might I add means much lower financial assistance from the insurance plan, meaning higher costs for the beneficiary even after they pay that deductible. Also, since we are on the subject, let's take a quick look at the difference in the copays just for, let's say, a primary care physician visit, a PCP visit. As we can see here, the in-network day one cost for a primary care doctor visit is a $5 copay. Conversely, for out-of-network doctors, there is a $750 deductible that has to be paid if it has not been met yet. Then instead of a set dollar copay, there is a coinsurance, which means that the beneficiary is responsible for 30% of the cost of that visit. So unless the doctor's visit's cost is $30 or less, the out-of-network is going to be considerably more expensive. Last up, let's talk about ED meds, because normally, whether it's an original Medicare, standalone Part D coverage, or through a Medicare Advantage plan with a Part D attached, medications that are seen as cosmetic, or maybe perhaps not medically necessary, are typically not going to be covered. This means that hair growth medications, Flintstone vitamins, weight loss, erectile dysfunction medications are not allowed to be included on those formularies and thus are not covered under Medicare Advantage plans in general, but they can be covered as supplemental benefits, not drug coverage, just extra benefits like gym memberships or groceries or dog walkers, and yes, erectile dysfunction medications is on this plan. So on the Blue Shield Select PPO plan, it is included, and that is a great news for those folks who find value and necessity in this types of medications that are available as supplementary coverage this year, that's 2025, on the Blue Shield Select. So as you can see, there are some pretty important financial and access to doctors networks trade-offs that come with getting a PPO plan. But the Blue Shield Select PPO plan, available in San Diego and Orange County in 2025, is a plan that, for the cost, does allow someone to sort of have the best of both worlds. Being able to see doctors in network for a pretty standard cost, and for a bit more if someone is willing to pay, or needs to for that matter, can go see a much wider network of doctors, but again, for a higher cost. So in a place like San Diego, where some of the biggest networks have foregone accepting any HMO plans at all, this may be a good option to keep one's preferred healthcare provider, even, again, at an elevated cost. All right, so that is it for today's plan reviews of the Blue Shield Select PPO plan for those counties of San Diego, Orange County in 2025. And if you or somebody you know wants more information about this plan or really anything Medicare related, feel free to reach out to us at the information down below, and we can assist them over the phone or in person at one of our offices across Southern California in English or Espanol. So for Michael's Medicare, I of course am Michael, hoping that you have a great rest of your day, and goodbye.